Herbal alternatives for managing equine colic, pain relief and anti-inflammatory options compared to Flunixin meglumine. Key points. Research suggests herbal remedies can help with pain and inflammation in horses with colic, but they may not fully replace Flunixin, especially for severe cases. White willow bark seems likely to offer pain relief and anti-inflammatory effects, similar to aspirin, but is milder. Chamomile, peppermint, and turmeric are also likely to reduce inflammation and ease digestive discomfort. The evidence leans toward consulting a vet, as herbs lack Flunixin's anti-endotoxic properties and may mask serious conditions. Herbal remedies can provide pain relief and anti-inflammatory effects for horses with colic, offering a gentler alternative to Flunixin meglumine, Banamine. However, they are best suited for mild cases and should always be used under veterinary guidance, especially given the complexity of colic, which can range from simple gas to life-threatening conditions requiring surgery. Pain relief and anti-inflammatory options. White willow bark is a top choice for pain relief, containing salicin, a natural aspirin-like compound. Chamomile and peppermint can soothe the gut and reduce spasms, while turmeric's curcumin offers strong anti-inflammatory benefits. These herbs can help manage discomfort, but they don't match Flunixin's rapid action or anti-endotoxic effects. Safety and limitations. Herbs are generally milder, but overuse can cause side effects like diarrhea. They may also mask symptoms, delaying diagnosis of severe colic. Always check competition rules, as some herbs, e.g., chamomile, are banned by organizations like USEF. Veterinary advice. Given the risks, consult your vet before using herbs, especially for severe colic or endotoxemia, where Flunixin's broader action is crucial. For mild cases, these remedies can complement care, but professional oversight is essential. Analysis of herbal remedies for equine colic. The following provides a comprehensive exploration of herbal remedies that can offer pain relief and anti-inflammatory effects for horses with colic, mirroring some actions of Flunixin meglumine, Banamine. Background on Flunixin and colic. Flunixin meglumine is a non-steroidal anti-inflammatory drug, NSAID, widely used for managing colic in horses, providing rapid pain relief, anti-inflammatory action, fever reduction, and anti-endotoxic effects. It is particularly effective for visceral pain and endotoxemia, common in severe colic cases. However, its use is associated with risks like gastrointestinal ulcers and kidney damage, prompting interest in herbal alternatives for milder cases. Herbal remedies, pain relief and anti-inflammatory effects. Several herbs have been identified as potential alternatives for pain relief and inflammation reduction in horses with colic. White willow bark, Salix alba. Actions: contain salicin, a precursor to salicylic acid, offering pain relief and anti-inflammatory effects similar to aspirin. It is often cited as a natural alternative to NSAIDs like phenylbutazone, bute. Use in colic, effective for mild to moderate abdominal pain and inflammation, particularly in spasmodic or gas colic. It may help reduce discomfort by targeting prostaglandin production, akin to Flunixin's mechanism, but is gentler on the stomach. Dosage: typically administered as a powder, with a recommended dosage of 10 to 30 grams per day for a 500 kilograms horse, mixed into feed. Precautions: avoid in horses with salicylate allergies, gastric ulcers, or those on other NSAIDs, as it may increase bleeding risk. Not suitable for pregnant mares due to potential uterine stimulation. Note that it is on the FEI controlled substance list, so check competition regulations. Comparison to Flunixin: offers milder pain relief and lacks anti-endotoxic properties, making it less suitable for severe colic but safer for long-term use. Chamomile, Matricaria chamomilla. Actions: anti-inflammatory, antispasmodic, and calming, with flavonoids like apigenin reducing inflammation and relaxing smooth muscles. Use in colic: ideal for spasmodic colic, reducing gut spasms and inflammation, and may help with stress-related digestive issues. Its calming effect can support overall comfort. Dosage: given as dried herb, 10 to 30 grams per day, or as a tea, steep 15 grams in 1 liter of water, cool, and mix with feed, or for a 500 kg horse. Precautions. Generally safe but may cause allergic reactions in horses sensitive to Asteraceae plants, e.g., ragweed. Prohibited in some competitions, e.g., USEF, so verify regulations. Comparison to Flunixin, less potent for pain relief, focusing on muscle relaxation and mild inflammation, but lacks endotoxic protection. Peppermint, mentha piperita. Actions: antispasmodic, anti-inflammatory, and digestive aid, with menthol relaxing smooth muscles and reducing gas buildup. Use in colic. Useful for gas colic and mild spasmodic colic, promoting gas expulsion and easing discomfort. May also encourage drinking, aiding hydration. Dosage: dried leaves, 10 to 20 grams per day, or diluted peppermint oil, 1 to 2 drops per 500 kilograms horse, mixed into a carrier like coconut oil, added to feed or water. Precautions: use sparingly, as excessive amounts can cause digestive upset. Essential oils must be diluted to avoid irritation, and some competitions prohibit use. Comparison to Flunixin, targets spasms and gas specifically, with milder anti-inflammatory effects, but not suitable for severe pain or endotoxemia. Dandelion, Taraxacum officinale. Actions: digestive aid, anti-inflammatory, and diuretic, rich in vitamins A, C, K, and minerals, potassium, calcium. Use in colic, supports digestion and reduces mild gut inflammation in gas or spasmodic colic, encouraging appetite and hydration for recovery. Dosage: dried leaves or roots, 20 to 40 grams per day, are mixed into feed or as a tea, steep 15 to 20 grams in 1 liter of water, or for a 500 kilograms horse. Precautions: safe for most horses but avoid in those with liver or kidney issues due to diuretic effects. Ensure plants are from unsprayed areas, and it is generally competition safe. Comparison to Flunixin, much milder, focusing on digestive support rather than acute pain or endotoxemia. Aloe vera. Actions: anti-inflammatory, soothing, and digestive aid, with polysaccharides and enzymes reducing gut inflammation and promoting healing. Use in colic, may soothe the digestive tract in mild colic cases, especially those linked to ulcers or stress, and supports hydration. Dosage: pure aloe vera juice, 50 to 100 milliliters per day, and mixed into feed or water for a 500 kilograms horse. Precautions: excessive use can cause diarrhea. Use food-grade aloe and avoid in horses with diarrhea or severe colic. Generally safe for competition. Comparison to Flunixin, focuses on gut soothing and mild inflammation, not suitable for severe pain or endotoxemia. Turmeric, Curcuma longa. Actions: contains curcumin, a powerful anti-inflammatory and antioxidant, blocking inflammatory pathways similar to NSAIDs. Use in colic, may reduce gut inflammation and provide some pain relief for mild colic, often used in combination with other herbs for enhanced effect. Dosage: typically given as a powder, 10 to 20 grams per day, or as part of a formulated supplement for a 500 kilograms horse, often with black pepper to enhance absorption. Precautions: avoid in horses with bleeding disorders, and ensure proper dosing to prevent gastrointestinal upset. Comparison to Flunixin, potent anti-inflammatory but slower acting and less effective for acute pain compared to Flunixin. Boswellia, frankincense. Actions: strong anti-inflammatory effect by blocking lipoxygenase, LOX, a mediator of inflammation. Use in colic, can reduce inflammation associated with colic, particularly in cases involving joint or muscle pain, supporting overall comfort. Dosage: often included in herbal pain relief formulas, with dosages varying by product. Consult product labels for equine-specific guidance. Precautions: generally safe but may interact with other anti-inflammatory medications, so monitor for side effects. Comparison to Flunixin, effective for inflammation but lacks rapid pain relief and anti-endotoxic properties. Ginger, Zingiber officinale. Actions: anti-inflammatory, antispasmodic, and digestive aid, with gingerols reducing inflammation and relaxing smooth muscles. Use in colic. Helps with mild digestive upset, gas, and spasms, potentially reducing pain associated with inflammation. Dosage. Fresh or dried ginger, 10 to 20 grams per day, can be added to feed for a 500 kilograms horse. Precautions. Avoid in horses with bleeding disorders or those on blood-thinning medications, and monitor for gastrointestinal irritation. Comparison to Flunixin. Useful for digestive issues but not as potent for pain relief or endotoxemia. Practical considerations and veterinary guidance. The use of herbal remedies for colic must be approached with caution. Research suggests that herbs like flax oil and magnesium can support gut health, but they are not substitutes for Flunixin in emergencies. Veterinary consultation is essential, as colic can be a symptom of conditions like intestinal torsion, requiring surgery, and herbs may mask pain, delaying diagnosis. Dosage and quality are critical, the need for equine-specific products and noting the lack of FDA approval for many supplements. Overuse can lead to toxicity, such as diarrhea from aloe vera, and competition regulations must be checked, as many herbs are prohibited, e.g., chamomile by USEF. Limitations and gaps in evidence. While herbs like white willow bark and chamomile have historical and anecdotal support, equine-specific clinical trials are limited compared to Flunixin's well-documented efficacy. Herbal remedies such as white willow bark, chamomile, peppermint, dandelion, aloe vera, turmeric, boswellia, and ginger can provide pain relief and anti-inflammatory effects for horses with mild colic, particularly gas or spasmodic types. They are gentler on the digestive system than Flunixin and may support gut health, but they are less potent, slower acting, and lack anti-endotoxic properties critical for severe cases. Always consult a veterinarian to diagnose the colic type and rule out surgical needs before using herbs. For prevention, incorporate probiotics and a gut-friendly diet, and check competition rules, as many herbs are prohibited.